So we are live now. Himanshu sir, please.
You can start. Okay. A very good afternoon and good morning to one and all present in this forum. I heartily welcome to our esteemed speakers and participants to this international workshop. And we have esteemed speaker. I will name all the speakers quickly. Professor Dr. Sudhir Kumar Sapati, Director, School of Public Health. Professor Dr. Helmut Brandt, Jean Manent, Chair of European Public Health and Head of the Department International Health at Maastricht University, Netherlands. We have Professor Dr. B Sunil, Professor, Department of Veterinary Public Health and Head Center of Excellence, Mid Science and Technology, College of Veterinary and Animal Sciences, Kerala Veterinary and Animal Science University. We have Professor Dr. Prakash Narayan. He's from Associate Professor at this Prasanna School of Public Health, Manipal Academy of Higher Education. We had Dr. Kiranjit Kaur. Actually, she was our speaker for today's forum, but unfortunately, due to some medical emergency at their place, she will not able to make it. But in her place, we have the speaker, Dr. Dona Bonan, and she's from Amrita Institute of Medical Sciences. And we have Mr. Moni Mohan. He's the CEO of Rural Institute of People's Enlightenment from Andhra Pradesh. And once again, I heartily welcome to our speakers and also all the participants. So for next 1 or 2 minutes, I will give a brief overview why this workshop and what is the background behind this workshop. So I'm putting my slide. So this today's workshop is a part of this project titled Risk Management and Prevention of Antibiotic Resistance Prevent It project, which is supported by Erasmus Plus program of European Union. So this is a project where 11 partner institutes are working in the consortium mode. And we have 5 Indian universities and 4 European universities and 2 non-governmental organizations. This is a 3-year project started with 2019 and it was supposed to end by 2021. However, due to COVID, the project has been extended for 1 more year. So the vision of this project is basically to create a favorable situation, enabling environment where every individual is aware of antibiotic resistance and empowered with right educations to address the issues of antibiotic resistance. So the main aim to promote qualitative teaching activities in academia as well as the societies. So main and what is called as achievement we are expected out of this preventive project is to develop and implement international interdisciplinary teaching curricula at Indian University on risk management and prevention of antibiotic resistance, invest in young talents, empowering Indian super experts having international outlooks, spread awareness in academia, students, policymakers, and in general public through public events and social media awareness campaign, create an interdisciplinary outline course to create awareness amongst the multidisciplinary target audience, and establish the first European Indian network to develop further initiatives for risk management and prevention of antibiotic resistance. You see, these are the, geographically, these partner agencies, they are located. In India, we have Chitkara University, we have Kalinga Institute of Industrial Technology, KIT universities, we have Symbiosis University, Manipal University, and Mata Amruta Vidyapeetham. We have 2 non-governmental organizations, Voluntary Health Association of India and RIFE. And Europe also, the partner university are Maastricht University, Netherlands, University of Milan, Italy, University of Riga, and University of Portugal. So this is geographically the university, the institutions, those who are involved in this project are located. And important thing is that because why we are gathering together today, because everybody know that antimicrobial resistance is a growing concern now it's a growing public health problem. And it occurs when bacteria, viruses, fungi, parasites change over the time and no longer respond to current antimicrobials, which making infections harder to treat and increasing the risk of spreading the disease, severe illness, and death. And there are also, important area that antimicrobial resistance can also spread through food chain and environment. Therefore, understanding the role that food and agriculture and the environmental sector play an important role in combating AMR. Because addressing, if you want to address the rising threat of antimicrobial resistance, it requires a holistic and multi-sectoral approach, One Health approach, involving integrated actions across human, animal, and environmental health sectors, because antimicrobial used to treat various infectious disease in animals may be the same or similar to those used in humans. Resistant bacteria arising either in humans, animals, or environmental may spread from one to others, and from one country to another country. So it's a need of the hour to understand and to follow this approach, what is called as One Health approach. So again, this background, today's deliberations focused on One Health approach in combating antimicrobial resistance. So through this deliberation, we envisage, that the participants will be definitely benefited to understanding basic aspects of One Health approach. What are the burden of the antimicrobial resistance across the globe and national, regional, and Indian perspectives? Then what are the mechanisms that both animal sector, agriculture sector, and environmental sectors, they work together how to address these issues? And at the same time, as the participant also get very much ideas about what are the activity, what are the work that has been done in India under these areas, and as well as from European experience. What are the different models, what are the different approach, through One Health approach that are being implemented in European regions. And also one aspect, how all these mechanisms, both agriculture, animal, and human, they converge at the grassroots level. We also, hear from the expert, from the community level convergence on this issue. So said this, I already set the context for today's discussions. So thank you very much and be present here. And I request Mr. Jyoti Prakash to take it over from now. Thank you very much.
Thank you, Associate Professor Himanshu Shekhar Pradhan, sir, for breaking the ice and giving us the context on the today's topic on One Health approach in combating AMR. To start with this session, I would like to welcome Professor Dr. Sudhir Kumar Sapati, Director, KIT School of Public Health, KIT deemed to be University Bhubaneswar. Dr. Sapati, he's a medical doctor, public health specialist, and an epidemiologist, and has a distinguished professional career of 40 years, mainly serving in developing countries like India and Nigeria. He has been working with the government of India in the past, NGOs, international agencies, and private sectors in lead roles. And his major contributions is in the capacity building of public health professionals, formulation of Indian public health standards for primary and secondary level healthcare facilities, mentoring public health programs, establishing quality assurance mechanisms, infectious diseases, NCD, and health system strengthening. So I'd like to welcome Professor Dr. Sudhir Kumar Sapati to give us an insight on today's topic on One Health approach to combat AMR. Sir.
Okay, thank you, Jyoti. And very good afternoon for all our participants and also the esteemed speakers. In my session, I will just touch upon the basics in relation to this One Health approach in combating antimicrobial resistance. Okay. So, as we are all aware that human beings, animals, plants, they coexist in a shared environment. And this coexistence benefits us immensely, but also there are problems, particularly in relation to microbial infections. Okay. Well, sorry for this. Okay, that's all. Okay, so whatever happens to humans, animals, plants, and in their shared environment, it is being shared with each other, particularly with this microbial infections. It moves from animals to man, and if there is infection, it has to be treated both in animals and humans, and we may use the same or similar antimicrobials. And any antibiotic, any antimicrobial resistance develops, then it also moves from animal to humans, humans to animals, and through the climate, it passes from the one person to the other, and also to the from one country even to the other. So this is the coexistence, and to control these infections in animals and human beings, we have antimicrobials, which includes these antibiotics against the bacteria, antivirals against viruses, antifungals against fungus, and antiparasitic against parasites. Now, I would like to draw your attention in this part of this, that antimicrobials handle with care. This is the message we want to give to our audience, that although we have several antimicrobials, but we have to handle with care in order to prevent this antimicrobial resistance. As we know, that antimicrobial resistance in the microbes, they develop when they are exposed to these microbes, they are exposed to the antimicrobials, and in a process of natural selection and genetic mutations, in a gradual process, they develop this resistance. But many of our human factors or human activities that enhances or fastens this natural process of acquiring this antibiotic resistance. So I will move to that one, that we have a problem, that is antimicrobial resistance, and many of our human factors is raising or increasing this antimicrobial resistance. And the main drivers of this antimicrobial resistance are the misuse and overuse of antimicrobials in humans, animals, and also in plants. The poor diagnostic and prescribing practices, the doctors, the pharmacists, they are also party to this human factor of development of antimicrobial resistance. And patients are also there who do not follow their scheduled treatment of antibiotics. Poor hygienic conditions and practices in our health care facilities that helps in getting infection and also in that process antibiotic resistance development. Food chain also facilitates this transmission of AMR. So this, we have enough of evidence to show that bacteria, viruses, parasites, and fungals, they have all developed through our very commonly used antibiotics or antimicrobials. The problem is that we have very few newer antimicrobials. So that is the problem with us and our pharmaceutical industries. They are reluctant to invest more on R&D, research and development, to bring out newer antibiotics because they are not certain of their market. So we have very limited number of new antibiotics, and some of the antibiotics and antimicrobials were used for few months or years before, the microbes have also started developing resistance to these newer antibiotics even. So we have got very limited options, and this antimicrobial resistance is becoming a global public health problem, and WHO says that that means the AMR is the top amongst one amongst the top 10 global health threats. So this is the problem is there. Some also professionals think that it is a silent pandemic is going on, silent pandemic of AMR. So in this, we have this problem of AMR, and naturally we have to combat it. And for combating antimicrobial resistance, One Health approach is prescribed or suggested, which is a validated and holistic approach to tackle these health problems and also the antimicrobial resistance that is arising out of human, animal, plant, and environmental interfaces. So this One Health concept, I will better straightway move to this. Yes, this is, so that means it involves both animal sector, plant sector or agricultural sectors, human sectors, and environmental health. So if I show this from this slide, we could come to know that One Health approach is multi-sectoral. That means it involves all the sectors, related sectors. And then it is multidisciplinary. It involves microbiologists, it involves medicine people, it involves physicians, it involves public health, it involves many other disciplines. And that is why I call it as multidisciplinary. And there is the requirement of coordination, communication, and collaborations, as we see here in this. And in this, the stakeholders are those who are providers of service in human, animal, and environmental sectors. They must come together, they must coordinate, they must collaborate, they must communicate in order to achieve optimum health for animals and human beings, and also help in combating this antimicrobial resistance. So this is in nutshell about this One Health approach. And we need also apply the same approach because there are several reasons. We use the same or similar antimicrobials, and if the antibiotic resistance develop in animals or humans, it may spread. And AMR doesn't recognize the geographical or human or animal borders. It can spread. So that is how it is becoming a global health problem. And efforts of just one sector cannot prevent or eliminate the problem of AMR. So we need all related sectors to come together. A sustained, well-coordinated One Health response with a shared vision and goals is very much essential to combat AMR. Now let us come to this slide. It gives all what we want to know about this One Health approach in our AMR. So it involves the human sector, the food and feed, then plants and crops, animal sectors, the aquatic animals, and all these should come together. And there is no time to wait because the problem is increasing, and the time will come that our surgeons will be reluctant to or will be afraid of to conduct surgeries because they don't have any useful antibiotics or antimicrobials with them to protect from infections after surgery. So this is the situation. We have to act very fast, and in that process, we will be helping the development of in the world itself, and that is how our sustainable development goals also it has been incorporated that we have to combat antimicrobial resistance. We have to accelerate the process in countries. We have to innovate. We have to collaborate. We have to invest more funds. We have to strengthen our accountability and governance, etc. So effective implementation of One Health approach, it needs political commitment, strong commitment, which is available in India and in many countries also, because they have been signatories to the UN declaration. And so, and good governance is required. Then it requires capacity development across sectors. We need national legislations to control this use of antibiotics. Then human and animal health sectors, they must work together at national, global levels to align policies, strategies, and activities. We must also use the AMR Awareness Week that is usually celebrated from 18th to 24th November every year, and a global health, One Health Day is also observed. So we must utilize all these avenues with us to combat antimicrobial resistance. The success of this One Health implementation will depend on institutional collaboration, the extent of institutional collaboration, joint planning and coordinated comprehensive surveillance, evidence-driven planning, implementation, and monitoring of multi-sectoral capacity building, inclusion and visibility of educational curriculum and skill upgradation. And we should not take this approach as purely a governmental endeavor. Here, the government, the private sector, the civil society, the associations, the academia, the researchers, all are to be involved. And awareness of individuals and civil society is a must, and research has to be conducted to understand the risk management, economic implications of AMR, improving intersectoral coordination, and transmitting global best practices into national action plans, and develop or innovate cost-effective interventions. We must take actions at the local, national, regional, and global levels to combat antimicrobial resistance. So this is in short. Our esteemed speakers will further elaborate in their respective fields. So thank you very much.
Thank you, Professor Dr. Sudhir Kumar Sapati, for giving us a brief insight on what is AMR, then what is about One Health approach, why do we need the One Health approach in combating AMR, and how the success of One Health approach depends on its various recommendations that we have mentioned. Now, I would like to welcome Dr. Dona Boban from Amrita Institute of Medical Sciences. Dr. Dona Boban is a public health professional who has immense experience in various health-related projects from state, international organizations like WHO, etc. So I welcome Dr. Dona Boban to commence a session on the burden of AMR in the perspective of global, regional, and national perspective. Over to you, Dona, ma'am.
Thank you, Mr. Jyoti, for your kind introduction. I hope my screen is visible. Can you just confirm? Yeah,
yes, ma'am.
Thank you.
Yes,
good afternoon to the audience in India and good morning to the European partners. It's an honor to share this platform with the experts in the field. In this presentation, we will concentrate more on the burden of AMR, wherein we will discuss on the global, national, and regional level data, the economic burden, patient and healthcare burden. I understand that there will be a number of so much of numbers in this presentation, but I have tried to keep it as much enjoyable as possible. So we know that Mr. Alexander Fleming discovered penicillin, the miracle drug, which paved way to revolution in modern medicine. Antibiotics are considered as the cornerstone of the modern medicine right now. Almost all the procedures in the medicine are dependent on effective antibiotics. Let it be the treatment of wound infection, let it be cancer treatment, or the organ transplant. The use of antibiotics was not limited to humans alone. We used antibiotics in animals to promote the growth, prevent diseases, and treat them. We also used antibiotics along with pesticides and insecticides in plants to control the diseases of plant. But during the times of reckless antibiotic use, we forgot one thing, that the antibiotics are not like other drugs. Antibiotics are societal drugs. So what does I mean by societal drugs? They are unique in that both the individual patient and the broader society bear the consequences of the use of each prescription. Whenever a person consumes antibiotic, the effect that saves the life of that patient also exerts a selective pressure on replicating bacteria, leading on to emergence of drug resistance. And as mentioned by the previous expert, antibiotic use is one of the main drivers for the emergence of drug-resistant organisms. AMR or antimicrobial resistance is not a new phenomenon. In fact, Fleming had warned us during his Nobel Prize speech on the consequences of unwarranted use of antibiotics. The text in red font highlights his warning to the humankind, wherein he has openly told us that there is a danger that the ignorant man may easily underdose himself, exposing the microbes to non-lethal quantities of the drug and make them resistant. But did we heed his warning is the question. We are familiar with the concept of survival of the fittest. Bacteria are no exception to this. They are constantly fighting against the antibiotics in order to survive. We were busy developing new antibiotics, and bacteria were and are busy developing resistance to those. For example, let's check out the penicillin and streptomycin. Penicillin and streptomycin was in use from early 1940s. The first resistance was reported in late 1940s for penicillin and late 1950s for streptomycin. Time forward, check out for levofloxacin. The start of use of levofloxacin and the development of resistance towards it took hardly a year, as shown in this graph. So why are we talking so much about antimicrobial resistance? Studies show that currently 7 lakh people die every year due to AMR, which is definitely an underestimation due to poor surveillance. 2 lakh people die every year due to multi-drug resistant and extensive drug resistant TB alone. The resistant neonatal infections are claiming lives of 60,000 newborns every year in India. Humans are playing a crucial role in selecting antimicrobial resistant microbes and helping them grow. Let us see this graph. There's a clear association between consumption of antibiotics and the development of antimicrobial resistant strains of microorganisms. Inappropriate prescription, poor adherence to the therapy, utilization of counterfeit drugs, all contribute to the selection and spread of antimicrobial resistance. So in countries like Netherlands, where we have strong antibiotic policies, we can see that the resistance levels are far less as compared to countries like Spain and France. This is the situation in Europe. So let's see how much antibiotics do the world consume. The study shows that in between 2000 and 2015, globally, we see an increase in 65% for the antibiotic use. But the most startling point is that most of the increase is seen in the low and middle income countries, contributing to 114%. And in 2015, the leading LMIC consumers were unfortunately India, followed by China and Pakistan. Worldwide, while that data was regarding the human use alone, let's see, the worldwide, the bulk of antimicrobials is in fact not consumed by humans, but rather given to animals. In US, antimicrobial use in the livestock sector accounts for about 80% of the total consumption. Demand for animal protein is rising worldwide, driving up the consumption of antimicrobials in the livestock sector. If the current trend continues, between 2010 and 2030, the global consumption of antimicrobials in the livestock sector is projected to increase by about 67%. The data on antibiotic distribution in environment is also very disturbing. 67% of world's rivers are contaminated with antibiotics. Studies also show that in River Danube, 7 different antibiotics were identified. In some regions in India, the antibiotic concentration in the wastewater is higher than the concentration in blood of patients who are under antibiotic therapy. And experts are projecting a 65% increase in drug concentration in water by 2050. It's very disturbing. So now we know that antibiotics are used in humans, animals, and plants. The consumed antibiotics are not completely metabolized. The unmetabolized antibiotic residues, along with the resistant genes, are spread between humans and animals through direct contact or by consumption of animal food products. Similarly, the genes or resistant bacteria spread between humans, animals to the environment through direct spread or through urine, feces, or through the surface runoff. Pharma industries also play their own part by spreading the residues through effluents. Hence, we can see that humans, animals, and environment are interconnected. Hence, AMR is a One Health issue. The use of antibiotics in any one of these elements will have repercussions in all the arenas. antimicrobial resistance is a global threat that spans all countries, even those with countries having lower consumption of antimicrobials. The epidemiology of resistance is multinational, and there is evidence that resistant microorganisms do not recognize any boundaries. And I can show you one evidence. This animation shows how the New Delhi metallo-beta-lactamase 1 gene, MDR strain that was discovered in India in 2006, spread across the world in a span of 9 years. So yes, superbugs, antimicrobial resistance, there doesn't respect any geographic borders. In India, 13% of hospitalized patients with resistant infections dies every year. Death rate among MDR and XDR patients are 2 to 3 times higher than those with infections that are susceptible to antimicrobials. A quick check on what's happening in Odisha. Though I couldn't find state-level data, a number of small-scale studies were conducted across humans and animals in the state. For example, in 2020, a study on incidence of bacterial pathogens among diarrhea patients in tribal areas showed the presence of multi-drug resistant E. coli, Vibrio cholerae, Salmonella species, and Shigella species. A study conducted in 2019 for studying the etiology of childhood diarrhea among the under 5 children showed that more than 50% of the strains within the study were multi-drug resistant. In a 2016 study conducted in animals, the drug resistance was identified against tetracycline, sulfamethoxazole, trimethoprim, gentamicin, the drugs that we humans use nowadays. Now, this is a concern. AMR is a concern because the entire foundation of modern medicine is shaky. We will crumble down with high rates of mortality and morbidity due to the drug resistance. Mortality rates are higher among patients with resistant infections, just like I mentioned before. Drug-resistant infections also lead to prolonged morbidity among the patients. They also have an increased chance of developing other complications. Treatments for drug-resistant infections are definitely intensive, and so are the adverse reactions. Identifying the correct therapy takes more time as compared to the susceptible strains, which in turn could lead to worsening of patient condition as he or she waits for definitive treatment. AMR increases healthcare cost compared to an antibiotic susceptible infection. An antibiotic resistant infection is responsible for about $6,000 extra healthcare cost. And this extra healthcare cost is due to use of more aggressive therapy, extra investigations, more intensive procedures, excess length of stay, nursing care, medical resources. All these are contributing to the additional $6,000. Similarly, as we go higher up in the ladder of antibiotics, the cost increases per tablet. And the situation is same across any infection. Let it be gonorrhea, let it be pneumonia, the situation is same. AMR definitely comes with its own share of economic burden. Patients with resistant infections lose income due to longer time away from work. They have to spend more money to treat resistant infections, thereby taking a toll on their day-to-day lives. The prolonged periods of sickness temporarily reduce the size of the global workforce as well. As pointed out in a study done in India, the overall extra cost to treat a single resistant bacterial infection is approximately $700, which is equivalent to more than 1 year of work for a rural male casual worker. So that's something huge burden for the normal people in India. So drug resistance accelerates the vicious cycle of poverty and infectious diseases. Poverty leads to poor nutrition, poor hygiene, and low access to healthcare. This could in turn lead to infectious diseases, including the resistant ones and the spread of the same. Ultimately, it will increase the cost of treatment, which will push the patient into poverty again, and the cycle continues. If we are not acting now, it's been predicted that 10 million deaths will happen every year due to AMR by 2050. To break it down, one person will be dying every 3 seconds due to a drug-resistant infection. That means, tuck, 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 one person death. That's it. And the world GDP will fall by 2 to 3% by 2050, costing $100 trillion loss. It's unfortunate to see that by 2050, the maximum number of deaths due to AMR is predicted to be happening in the Asian continent where we live. So we also have predictions by the OECD and by the World Bank. The OECD predict that across Europe, North America, and Australia, 2.4 million people could die of antimicrobial resistance. And World Bank predicts as many as 24 million people worldwide may be forced into extreme poverty conditions. And the main burden of this economic downturn will be on the no LMIC countries, and it can be compared to the financial crisis that happened in the year 2008. So it's time for action, and the best approach to move forward is the One Health approach, which we will be discussing in the following presentations. Before wrapping up, let's remind ourselves again that we are living in a time where some miracle drugs no longer perform any miracles, and families are being ripped apart by a microscopic enemy. Thank you.
Thank you, Dr. Dona Bhuban, on giving us an insights on the burden of AMR, its concern, and with respect to the present and global scenario, then why AMR is a concern with respect to the patient perspective and economically how they are burdened, and what is the future scenario if this AMR problem is not tackled in a much broader way. With this, I would like to welcome our new next speaker, Dr. Prakash Narayan, who's a preventive coordinator from Manipal Academy of Higher Education, Manipal, India. Dr. Prakash Narayan is currently working as an associate professor at Prasanna School of Public Health, Manipal Academy of Higher Education, Manipal. He has been actively involved in teaching and research activities, which includes communicable and non-communicable diseases, occupational health, reproductive health, nutrition, mental health, digital health, One Health approach, and drug resistance. And not only that, he has also conducted various national level research studies on HIV, reproductive health, family planning, education, and child labor. With this brief insight, I would like to welcome Dr. Prakash Narayan to give us a broad multi-sectoral involvement in approaches in tackling this AMR with respect to the mechanisms and issues in the different multi-sectoral approach. Sir, over to you, sir.
Is my slide visible?
Yes, sir, it's visible.
Yeah, thank you. Thank you, organizers, and good afternoon to all Indian participants and speakers, and very good morning to our European partners. So I would like to share the importance of multi-sectoral approach and the challenges in the coming slides. So the previous speakers mentioned about the importance of One Health approach and the burden of the diseases. So in this talk, I would like the audience to understand about why this approach is important and why we need a multi-sectoral approach to tackle or combat AMR, and the benefits of such an approach, and what are the challenges in implementing One Health multi-sectoral approach to combat AMR. So, as Dr. Sapati and Dr. Dona mentioned about this One Health approach, it is a collaborative, multidisciplinary, and multi-sectoral approach. And the burden is already mentioned. And we need a collaborative, multidisciplinary, and multi-sectoral approach at various levels to tackle the issue of One Health, and particularly the antimicrobial resistance. So as you've seen many pictures so far, so same means human beings means living in the planet, and we are dependent on many things like and this AMR is there everywhere. It can come from healthcare institutions, it can come from travel, it can come from trade, it can come from natural habitats, it can come from agriculture, it can come from wild animals or domestic animals, aquatic animals, and everywhere. So, and this figure already has shown and explained. So the waste or the resistant bacteria move around, and it will affect humans at the end. So that is already mentioned. So I'm not going to explain much. And yes, as the recent FAO, Food and Agriculture Organization, and Organization for Animal Health and World Health Organization, in collaboration with the United Nations Environment Program, statement last week mentioned about the importance of One Health approach to combat AMR. So talking about One Health and linking and collaborating and coordinating and building capacities across sectors is important in tackling One Health issues, and particularly it is very, very relevant in dealing or combating antimicrobial resistance. Yes, as we know that this antimicrobial resistance is not just limited to human health issues. It's an issue across sectors. So if we want to tackle this, we need policies, guidelines, partners, actions across broad range of areas and broad sectors. So as you can see in this diagram, the plan, suppose we want to contain or combat antimicrobial resistance, we need policies across various sectors, like in the human sector, we talk human health security, infection prevention control in the hospital settings, on health approach, medicines, mental health, water sanitation and hygiene, surveillance, communicable diseases, health system strengthening. All these policies, we need to include the policies to address antimicrobial resistance. Similarly, in animal sector, the policies or guidelines regarding feed safety and quality, biosafety and hygiene, flock and health management, and veterinary medicines. All these guidelines and policies, we need to include AMR. And in plant sector, food safety, plant health, crop production, pesticide management, all those need to be tackled, and means we need to have policies related to antimicrobial use and resistant to contain resistance. And in environment sector, waste management, water management, soil management, environment management, all this need to be integrated, or you can say the other way around, the policies to, or the actions or the guidelines to combat antimicrobial resistance to be integrated to the policies related to environment. And so, in a nutshell, this picture says that if we want to combat AMR, we need AMR in all policies, or the plan of plants. So all the plants may need a plan to contain antimicrobial resistance. As you might be knowing, this SDG, Sustainable Development Goals, by 2030, they they took this holistic approach, and they are talking about if you want to improve or you can achieve this universal health coverage by 2030, you need a holistic approach. similarly, to tackle antimicrobial resistance, we need a holistic approach, and we need antimicrobial policy in all policies. So we are moving from universal, health for all to universal health coverage and health in all policies. Similarly, AMR in all policies. That will be the kind of approach we may have to go with. So for that, because we have a lot of partners, players, or sectors involved in it. So what is multi-sectoral approach? So multiple sectoral approach is a collaboration between institutions of different areas of policies. Okay, it can be human, animal, environment, or social sectors, and different sectors like public sector, private sector, third parties, or industries, or other trade, and then communities working together to achieve a better outcome. So this multi-sectoral approach or collaboration will not come by its own. So the concerned people or the nation or the world globally, we need to have deliberate actions and attention to achieve this multi-sectoral coordination between partners. So for that, we need political support or political will, economical and social factors, and the other partners to agree or buy the concept. And we have to work with different partners. So as all of you know, there are two types of policies. One is bottom up, top to bottom, and the other one is bottom up. So since antimicrobial policies cut across sectors and policies, we may need, and many players and many mechanisms and tactics arises. We need both the approach, like bottom up or top down approach. Both are important here. There's certain places or certain countries, they have the political system or the governance system. So accordingly, we have to have one system or one approach may or may not be enough to combat such complicated and multi-sectoral issues like antimicrobial resistance. Okay. So there are certain principles when you are talking about multi-sectoral approach or collaborations. So one is different partners or players or influencers. So we need to respect and protect and promote their rights and their cultural values, and there should be clarity on the roles, responsibility, and delegation of the roles, responsibility, and then all these players has to abide by the promotion of human rights, ethics, and equity, and we need to have we mobilize resources and facilities and to facilitate the partnership activities and timely assessment or evaluation of the outcomes of such an approach or collaboration. That is important. Okay. And when you are talking about this multi-sectoral approach, particularly in the case of antimicrobial resistance, we generally start with health sector, human health sector as the major player. Because antibiotics, when we are talking about or hearing about antibiotics, we always think about medicines and health sector. So, but here the involvement of health sector can be at different levels, and the role of health sector or health department can be at different levels. So I'm just giving an example, like certain activities, the health department have minimum roles, like say education. So a department will do or we provide information or capacity building and make the people literate so that they can take informed decisions. and say rural development, urban development, municipal corporations or municipalities, they do what is it, or their sewage or maybe water purification, or so their own activities. Those the health department have very minimal role, but health will be assured. So the people will be healthy if the other department do their function. So the role of health department is minimum in this case. And in certain conditions or certain departments, partners, the role of health department is will be as a supportive actor. So they have been health department has to help them to develop their own guidelines or means involvement. What is it? Institutionalized mechanisms, or maybe provide leaderships on how to do things with their respective departments. And certain models, means or sectors or partners, the government need to collaborate with other partners to make sure that things are happening in a particular sector, say industrial sector. So industrial sector, and if you want to contain antimicrobial resistance, say like a pharmaceutical industry or maybe the industrial pollution, the health department along with Department of Industries or Environment and Forest, Department of or Ministry of Environment and Forest, they all have to work together to ensure that this antimicrobial resistance issue could be minimized, because that will be the capacity of the Ministry of or Department of Industries or certain sectors are limited. So the role of health department will be very high. And in certain conditions, when the collaboration, the health department has to take the lead and help other people and invite other people and get the help of other sectors to support their activity. So these are different roles of engage, or we can say engagement mechanisms which health department can take according to the type of partners or the collaborative partners or sectors. So there are many frameworks related to the various aspects of multi-sectoral approach. This is an overall framework I'm just presenting, and also there are frameworks on governance or maybe health system strengthening for and public health actions, combined actions. So more than I came across around 10 different frameworks, but I found this maybe much applicable to contain or combat antimicrobial resistance. So this framework mentions that if you want to have a successful collaboration or multi-sectoral collaboration, we need to have a proper definition of what is that, why we need it, the focus and aim, or I can say objective of that particular collaboration, and what could be the preconditions of which industries or which areas we'll be discussing. So then the structure of that particular collaboration or multi-sectoral collaboration, and what are the process involved in in the functioning of that collaboration or the network, and then what are the expected outcomes out of this network or collaboration, and what will be the contribution by different players in the collaboration. So yes, then I'm not going much into the collaboration and the details because of paucity of time, and the other speakers, their sector experts, will discuss more about the activities which they are doing as part of antimicrobial resistance. So I found a study which is talking about strengthening multi-sectoral coordination on antimicrobial resistance the efforts already undertaken in 11 countries. So what they found is that just or mere having an antimicrobial resistance means a national action plan for antimicrobial resistance may not be sufficient. Okay. So, and they recommend that this national action plans must be implemented through a functional multi-sectoral collaboration and supported by effective technical working group members or groups on specific technical objective areas such as infection prevention and control, antimicrobial stewardships, and surveillance in different sectors. Okay, so from these 11 countries, what they found that many countries may lack certain things, but what they recommend is for a successful multi-sectoral collaboration, the countries need effective terms of reference in place, and the partners, collaborators should adhere to it. And then they should be establishing or strengthening the capacity of specific technical working group members and the activities or the technical areas where they are working. And not just formulating a multi-sectoral collaboration will not be sufficient, but there should be regular meetings and information sharing between the partners should be happening regularly. And then the countries need to identify and prioritize which sector to be tackled to as part of this combating antimicrobial resistance. So, which are the feasible sectors we can start working with, and which is having or which is what is creating maximum antimicrobial resistance. Say, as the previous speakers mentioned, maybe agriculture sector or the animal sector that is consuming or using maximum antimicrobials. Then that may be the priority partner in a multi-sectoral collaboration. Okay, so we have to identify such, then which is the priority and which have got maximum impact. So based on that, we have to identify the partner institution or partners and then follow up the actions. And yes, again, levels of capacity to have an effective multi-sectoral coordination. So these 11 countries, based on the study, what they identified is certain countries don't have any capacity, or can say no capacity countries, where they don't have any national action plan for antimicrobial resistance. And for that, they recommend to develop an action plan or to contain antimicrobial resistance. And certain countries have limited capacity, like they already have a national action plan, but they might have created a multi-sectoral coordination mechanism, but again, their recommendation is to identify which of these sectors which has got creating maximum antimicrobial resistance and the guidelines. Then certain countries already developed the capacity on multi-sectoral coordination. So for them, the suggestion is to develop plan of action and continue to delegate the jobs, or you can say terms and preference, and organize regular coordination meetings. And certain countries are demonstrated the capacity and upon they already have an effective multi-sectoral collaboration. So for them, they have to prioritize actions and implement the National Action Plan along with monitoring and evaluation frameworks, and means they have to look forward about how to sustain these actions. So the last is about some countries, they already have demonstrated the capacity and working on it, but the idea is this is not one-time action. It is this containing or combating antimicrobial resistance need to be there forever till resistance or the burden will decrease. So for that, the countries need to sustain this demonstrated capacity and abandon effort, and they have to find opportunities, financial opportunities to sustain the actions, and periodical assessments and corrective actions, if or maybe adding more partners or maybe changing the roles and responsibilities. So those things are required. And like any other sector or any other action, this multi-sectoral collaboration or approach also has got its own challenges, because it's a collaboration of multiple sectors and multiple partners. So they have different expectations from the collaboration, and many are working for profit, many are for the benefit of the society, and so their interest in being part of collaboration, and there may be conflict of interest between sectors within the collaboration, and many times people, the sectors are ready to be part of a collaboration, but after once this collaboration is established, this lack of clarity on how to go about and lack of guidance on how to move forward. So we need to have proper guidelines on how to proceed further once you have the collaboration. And then who are the leaderships, support from the parent institutions, the members who are part of the collaboration, they may get limited support from their parent organizations, and there may not be no resources, no facilities, or no support is extended to these members. And many times there may be power equations, like some from certain sectors, higher officials will come and they can commit their involvement or maybe what they can do. And certain institutions, the members in the collaboration, or they have limited capacity to commit things. Then many countries or many institutions may not have a proper framework on what they really want out of this collaboration and how to move forward and how to engage the partners. And in antimicrobial resistance, even though we have many partners, we may need support from all sectors. The responsibility and the role will be at different levels. So like certain institutions, they really have to work and as part of the collaboration and contribute more. Certain sectors have lesser capacity and lesser importance, or you can say not importance, we cannot say importance. They have very limited role to play in combating antimicrobial resistance. And another issue is the coordination between levels of the partners. For example, these policies, National Action Plan, we can say, on antimicrobial resistance. So the top, we can say, central government adopted it, and we have a policy on antimicrobial resistance in, say, 2012, and we have a National Action Plan in 2017. but it has not percolated down to the states. The states are yet to buy the concept and adopt it to their system. Because this health is a state subject, so central government used to give the guidelines in Indian situation I'm talking about, but many states are yet to buy or maybe give due importance to the National Action Plan on containment of antimicrobial resistance. So that is one. Even though the central government is thinking it is very important and ready to start this one, the priority at the lower levels of the health system is very different. Say nowadays, it's more of COVID. So all the workforce in the local level are engaged in those kind of activities. So the priority at the very local level may be different. So at different levels, the priority on antimicrobials are very different. Similarly, the priority on antimicrobial between sectors, within sector and between sectors. So for pharmaceutical industry, promotion of the sale of more antibiotics or antimicrobials is there. Usually. So that's what they promote. But there may be conflict of interest and taking this and minimizing the use of antimicrobial use and all those things may be different in different sectors. So they think the partners may have certain issues in understanding their issues, and even if they have, they could be part of it. The coordination between levels and between organizations or sectors is not that very easy. It's a challenging task. And another issue is who will be documenting the best practices or the success of such collaboration. So unless there is proper harmonized or integrated system to report these collaborative activities, many other sectors may not be reporting it or recording it clearly in their routine systems. So if we want a better multi-sectoral collaboration, we should be having a better monitoring and evaluation system along with this collaborative approach. With that, I stop. And I think India already, based on this talk, you may be knowing that India is somewhere in the second phase or third phase of the capacity. India has got maybe the limited capacity at this point of time, and the COVID hampered much more because there's no budget allocation this year for antimicrobial resistance. So these are the, I think with that I'll stop my presentation. Or maybe I talk. Yeah.
Thank you so much. So we'll take the questions afterwards. Thank you so much, Dr. Prakash, on enlightening us and the participants on the need of multi-sectoral coordinations for AMR, the various roles and engagement of different sectors involved in the coordination of AMR. Then why there is a multi-sectoral approach framework is needed to have this coordination among all the sectors, approaches that have been implemented in various lower middle income countries, and the challenges that these multi-sectoral collaboration face during implementing this One Health policy. With this, I would like to move to our next speaker, Professor Dr. B Sunil, who hails from Department of Veterinary Public Health as a professor, and he's also the head of Center of Excellence in Meat Science and Technology, College of Veterinary and Animal Sciences, Kerala Veterinary and Animal Sciences University, Kerala. Dr. Sunil is having 26 years of experience in teaching, research, and extension activities in the area of animal husbandry and veterinary public health. Not only that, Professor Sunil has been involved in training of veterinarians, medical professionals, food safety officers, industry professionals, entrepreneurs in the area of food safety hazards and risk analysis, and implementation of HACCP, GMP, and One Health approach. With this, I would like to invite Professor Dr. B Sunil to give us his experiences from Indian perspective in combating AMR using One Health approach.
Jyote, you will be sharing the screen, please.
Yes, sir, I'm just doing it.
Yes, please. So at the outset, it is extremely wonderful to be along with the esteemed participants of this international workshop on the One Health approach in combating AMR. And let me thank the organizers for the special invite to participate and engage with the participants. I would also mention my co-speakers, Dr. S.K. Sapati, Director, School of Public Health, Professor Helmut, Dr. Prakash Narayan, Dr. Dona, and Dr. Mohan, who will be sharing their experiences along with us. Can we have the next slide, please? Yes, thank you. I think all along when we are talking of AMR, we have been projecting, and in all our discourses, whenever we have, it is mainly connected to the human health, the hospital settings, or maybe the veterinary settings, the veterinary hospitals, the veterinary farms. But I think, like, when you're looking at the Sustainable Development Goals which has been projected for 2030, the 17 goals which has been projected. And if you look carefully at it, probably each of these goals have a direct relationship to the AMR which we are talking. And probably this AMR could be having a very, very significant influence on a majority of these goals which we are talking of and which we need to sustain for a sustainable development. And this being the case, if you quickly look at it, number one is no poverty. Definitely, you're going to have AMR as an ingredient in that. Zero hunger, definitely, yes. Good health and well-being, yes. Quality education, yes. Climate and sanitation, yes. Then you have your, decent work and economic growth, definitely, yes. Because we have not been, I think, projecting on the impact of AMR on probably our workforce. And also Dr. Dona has put up some of the statistics with regard to that and the economic impact of this. So I think probably this narrative is the one which we need to carry forward so that, the importance of AMR will be ingrained in the policymakers and the powers that be. Can I have the next slide, please? And among this, so one of the most important things where we need to stress. Now, this is a vicious cycle. Dr. Dona has beautifully presented that. The food security, yes, the clean water and sanitation, and the health of human beings and animals. Now, this is an area wherein if you take from this sustainable developmental goals, this cycle is the one probably we need to focus and tackle and give importance to. Can we have the next one, please? Yes. So as we have already seen, I'll not go into the details of this because it has been beautifully explained by my previous speakers. The drivers of antimicrobial resistance lie in human, animals, plants, food, and environment. And it is just because of this reason that we are propagating a sustained One Health response so that we'll be able to engage and unite all our stakeholders around a shared vision and goal. Now, this is the purpose of One Health. Now, can I have the next one, please? Next slide, please. Yeah, I will quickly be taking you through the Indian initiatives, that is the AMR Indian initiatives, so that you can have a look like what has been done in the country, because a lot of things have been done, but we need to put these things in the right perspectives and take it along. Probably, yes, if you look at 2007, we had the BIS specifying, giving the specifications on poultry feeds, banning the use of antibiotic for growth promoters. In 2009, we had the GARP, the Global Antibiotic Resistance Partnership. In 2011, the Food Safety and Standards Authority of India came up with the tolerance limits for antibiotics in veterinary use. In 2012, there was a launch of ICMR Antibiotic Stewardship Program. In 2013, again, we had the National Livestock Policy, which very significantly had a saying on the rational use of antibiotics to be prescribed by the states. Then in 2014 and 15, we had the first One Health Center, the cohort, which was established under the Kerala Veterinary and Animal Science University, specifically to give into this programs for capacity building among various stakeholders, and also build up curricula among the universities and for students with regard to AMR and One Health. What exactly it is One Health? Because as Dr. Prakash was saying, without knowing how best we can take understanding One Health and then taking it forward, it will be very difficult for us in a country like ours to start thinking of and implementing One Health. Yeah, next one, please. And again, in 2016, we had the National Treatment Guidelines for Antimicrobial Use in human settings. In 2017, we had the Indian Network for Fisheries and Animal Antimicrobial Resistance Collaboration, the INFAR, which was a collaboration with the FAO. And the National Action Plan on AMR was also adopted. And in 2018, we had the state plans for containment of antibiotics coming up. Then in 2019, we had the ICMR treatment guidelines on antimicrobial use for common syndromes being put up. Next one, please. I'll just quickly go through some of the gist of the major landmarks. We had started with the Jaipur Declaration in 2011, where all the ministers of the member states of WHO, Southeast Asian region, including India, adopted this declaration. And in this declaration, previous, thank you. Previous one, please. Previous one, please. Yeah. In this declaration, the highlight of it was on a multi-sectoral steering committees and formulation of a national antibiotic policies. Then lab-based antimicrobial surveillance programs, hospital infection control policies, and evidence-based national antimicrobial prescribing guidelines. Now, this was the first time when that such aspect should be covered, was given up, and it was put up publicly in this Jaipur Declaration. Next one, please. Then we had the National Policy for Containment of AMR in 2011. Now, this a task force was formed for the containment in 2010, and subsequently the national policy for containment of AMR was included in the 12th five-year plan, covering the period 12 to 17. And some of the major recommendations included the launch of Schedule H1 for prescription of antibiotics. Next one. Next slide, please. The packaging to have a mandatory H1 warning, and the drugs to be sold only against a valid prescription, maintenance of a very separate register for storing the prescription data, and this register to be maintained for at least for 3 years, subject to inspection by the regulatory agencies. Next one, please. Then it also mentioned about the color coding of these antibiotics and ban on certain irrational fixed dose combinations to limit the abuse of antibiotics. Next one, please. Then came the Chennai Declaration of 2012, which was a joint meeting of medical societies in India. And that was the first time a roadmap was prepared to tackle the global challenge of AMR from the Indian perspective. There was a ban on OTC sale of antibiotics without prescription, in-hospital antibiotic usage monitoring, setting up microbiology laboratory facilities, and establishment of a national AMR surveillance. This was the highlight of this Chennai Declaration. Next one. Then we had the ICMR-mediated antibiotic stewardship program. Now, this was done in 2012 along with the Christian Medical College, wherein the focus was on developing capacity building and awareness program among all the stakeholders. Next one, please. The ICMR again came up with India's Antimicrobial Resistance Surveillance Network, AMRSN, which delivers a very accurate estimation of the drug-resistant infections and patterns of AMR among pathogens of human importance across Indian hospitals. So this was the first network which was initiated by the ICMR for the purpose. Next one, please. A very significant thing which came up was the campaign called as the Red Line campaign, which was lauded by world over. That is the 2016, which was an awareness campaign not to use medicines marked with a red vertical line comprising of antibiotics without the prescription of a doctor. Now, these were called as the medicines were with red line. Now, the antibiotics already had these red line, but the campaign was because the patients were often unaware of the meaning of the red line and the purpose for which it was put. So this red line campaign was a very successful campaign, awareness campaign by the Indian government. Now, we also have, just like the present program, the preventive initiatives, the programs along with the Indian governmental policies, Swachh Bharat Abhiyan and Skill India to improve the skill of and capacity building. And it also had a very significant role in building up the curricula for universities with the help of Indo-European consortium partners. Next one, please. Then we had the Stewardship Guidelines in 2017. That is, the ICMR again released the Antimicrobial Stewardship Guidelines, developed the curriculum, conducted workshops and capacity building, and guidance was given to all the hospitals to set up a particular structure and the process for the stewardship. Next one. Then came the second leg of this National Action Plan from the period 2017 to 21 for the next 5 years, which outlined the priorities and implementation strategies by the government of India for curbing AMR in India. So in 2018, India released a guidance document for all the states to formulate region-specific policies for state action plans. And Kerala became the first state to adopt that state action plan. As you can see, the Kerala Antimicrobial Resistance Strategic. The previous slide, please. Previous slide, please. The Kerala Antimicrobial Resistance Strategic Action Plan. Now, in that, if you look down, you can see a One Health response to AMR containment. So for this purpose, a One Health group was formed. That was a structure was set up involving the departments of agriculture, animal husbandry, then the environment, fisheries, the health and family welfare. And these people sat together and then worked out this strategy for controlling antimicrobial resistance through this policy. Next one. Now, in 2019, the ICMR came up with this treatment guidelines for antimicrobial use in common syndromes. So there was a usage that is rationalizing the type of antibiotics to be used on the national list of essential medicine, and also to have a consistency in the treatment protocols for various infectious conditions. Next one, please. Now, with regard to AMR research and international collaboration, also ICMR has taken various initiatives to develop new drugs and medicine through international collaborations. Collaborations with the Research Council of Norway, then with the Federal Ministry of Education and Research in Germany. That is an Indo-German collaboration for research on AMR. Next one, please. And in the veterinary sector, there was the formation of what is known as the Indian Network for Fisheries and Animal Antimicrobial Resistance, INFA. Now, wherein 9 veterinary institutes and 8 fisheries institutes joined together as member laboratories. And this was coordinated by the ICAR National Institute of Veterinary Epidemiology and Disease Informatics, Bangalore, to coordinate the overall technical and data management operations of the network, along with the Bureau of Fish Genetic Research in Lucknow. Next one, please. The Indian Council for Agriculture Research, Department of Animal Husbandry, and the Dairy and Fisheries and the Drug Controller has already banned the use of colistin as a growth promoter in animal feeds, especially in poultry. Then good farm management practices, control of infection and stress among flocks, and farm biosecurity guidelines have been issued. And guidelines on the use of antibiotics in animals have been issued by the Department of Animal Husbandry in 2014. A standard operating procedure in bacteriology in the veterinary sector jointly by ICAR and ICMR, so that the comparison of the isolates and the antimicrobial resistance pattern of the isolates could be studied. Then we also had the antimicrobial stewardship program exclusively for veterinarians. And the withdrawal period for various antibiotics. Withdrawal period for various antibiotics, especially in milk, for purpose of meat, and all those things have been set up. Yeah, next one. Then we had the integrated One Health surveillance network for antimicrobial resistance. Now, this was in collaboration with the ICAR and ICMR to assess the preparedness of Indian veterinary laboratories to participate in the integrated AMR surveillance network. And for this, the veterinary standard operating procedures, VET SOP, for enabling, as I said earlier, comparison of the antimicrobial resistance pattern of the various isolates which have been isolated from animals and humans could be studied upon. Next one, please. Now, with regard to the environment, we had the UN program and the ICMR together, which have launched a collaborative project on priorities for environmental dimension of antimicrobial resistance in India, recognizing the importance of this environment and the role it plays in dissemination of AMR. Next one. Now, not only that, the environmental protection, that is the rules in 2019 have been amended. Now, the antibiotic residues has been specified. The limit has been set in the effluents of bulk drug and formulation industry. And what has to be done with the sludge? It has to be incinerated. What are the conditions which are required? And all those things have been given in those amended rules in 2019. That is with regard to the environmental legislation which has come up. Yeah, next one. Now, as you can see, the One Health response, now it is having an impact on human beings. It is having the impact on the aquatic animals, food, feed, plants, water, sanitation, hygiene, and then ultimately the impact is going to be on human beings. Now that is the final thing which you are going to take up. Next one, please. Now, having said all these things, now there are certain gaps to be filled, and we feel that it is very important at this point of time. That is why I just showed up this our sustainable development goals. Improving the basic water, sanitation, and hygiene in healthcare facilities, in animal farms, schools, households, and community settings. This is extremely critical before we start looking into the other aspects. Now, or it could go hand in hand, the way we look at it. Strengthen infection control and prevention in health facilities, farms, food and feed production, especially when you're talking of a decreasing the antibiotics, phasing out of the antibiotics, you need to look at the biosecurity measures which are there at the farms and how best we can manage that. Improving the waste management and the environmental protection. And there are significant barriers, as just like the previous speaker was speaking, with regard to implementation of these action plans and how best we can go about it. Because there need to be adequate political awareness and commitment, and good information to be passed about what is required, about the importance of AMR to champion a One Health approach. So what we are lacking is a very compelling narrative to engage the policymakers, especially in the states, and also the general public, in the way that, as I said earlier, with our sustainable development goals, because that is right there in front of us, so that we can link the antimicrobial resistance to our core national health and economic interest. Moreover, these mechanisms and capacities for the One Health collaboration across ministries and sectors are quite inadequate and under-resourced. The funding for the purpose of AMR is absolutely not there. Next one, please. Now, to support and implement the action plan in key areas, you need to have an analysis of the evidence base, which is being worked out probably in the veterinary sector and the health sector. But this also needs to be worked out in the environmental sector. Developing suitable regulatory frameworks, developing the professional capacities to support responsible use, mobilizing human and financial resources, strengthening our supply chain management, especially that will be of importance in the industry, the legal and regulatory framework across this One Health spectrum. Then implementing the surveillance system as of now requires a significant long-term investment. There should be a long-term investment in personnel who are trained, the laboratory infrastructure, the infrastructure for data collection, and others. And lastly, you want to foster AMR research through greater investments. Now, if you look at it, how much of investment is coming in through funding for AMR research? So funding is one of the important aspects, again, which we need to highlight. Next one, please. Now, the constraints in this sector, that is having this multi-sectoral convergence, has very beautifully been explained by Dr. Prakash. I'll not go into the details, but some of the important things which we would like to share is, you need to have proper information sharing between the sectors. And you need to undertake common activities. Probably the health sector, the agriculture sector, or the environmental sectors, you say it is multi-sectoral and each starts working on its own. But that is not what is envisaged in One Health. Now, for that to happen, as Dr. Prakash was saying, you need supportive policies for each of this, because you have conflicting departmental priorities. I'm just listing a few because everything has been beautifully covered there. There are limited institutional capacities. So your priorities are not that. Your institutional capacity is different from the priorities which you're talking of. Then you need to bring them in line, because this is the most important thing which is going to be driving your future sustainability on the planet. So One Health funding is important. Now, why I say this is because you have seen the different states which have got this policies on AMR. Kerala has one, Madhya Pradesh has, and New Delhi has a policy. But then you need to have a common funding. You cannot say that, a health sector will fund whatever is needed for this. The other sectors will take care of their own business. No, that doesn't function that way. So that is why you need a One Health structure and funding. And to have that, what is required in the beginning is to have a One Health policy for it. What is your One Health policy? Before you start off your AMR policy, you should be talking of a One Health policy. Just by saying that, different ministries will collaborate, different sectors will collaborate, doesn't make it One Health. One Health, as has been beautifully described by Dr. Sapati, it is multi-sectoral, but the underlying feature of this is working together. Even now we are working in the multi-sector. There is multi-sectoral and cross-sectoral working on AMR. It is happening. That is why in all the initiatives you see, it is each department doing their business. But what is this convergence which is happening between them? That is one thing which is lacking. And it is One Health which says that, you should be working together. Working together is the crux of One Health. Whereas multi-sectoral, you work on the same thing, you work differently, but there is no convergence. So for that, you need to have a proper One Health policy, which can bridge in a structure for the whole of the country and probably for the states, because each state could also have a One Health structure. Just like, for example, Bangladesh has got a One Health structure. India should also be looking at having a One Health structure, so that once that is done, the various issues which require the One Health could be taken up by this authority. Next one, please. Next one. So this again calls for, as I have said, shared vision and goals. So you're sitting together to work with a common vision, common goal, and common funding. So this is what One Health is all about. Next one, please. So ultimately, this was already shown by Dr. Sapati. to have sustainable development goals in place, if you're thinking of having that, then you need to have this coordination mechanism in place. It could be the One Health approach. You need to have this acceleration of progression with regard to AMR in countries. Innovation is very crucial. Collaboration for effective action, that is what the One Health concept is all about. Investment for the response, that is the funding is crucial. And then we are talking of the accountability, leadership, and governance. So that will probably bring in the whole lot of convergence, what we are all talking about. So with that, I will end my session. Thank you very much for this brief interaction. We'll take any questions at the end.
Thank you so much, Professor Dr. Sunil, for giving us an brief insights and discussing the One Health approach in combating AMR with the experiences from India with regards to the surveillance system by ICMR, the National Action Plan being formulated, and the SOPs which has been created. But still, there are certain constraints which need to be addressed in a various cross-sectoral convergence. So with that, I would like to invite our next speaker, Professor Dr. Helmut Brandt, who is a Jean Monnet Chair in European Public Health and Head of the Department of International Health at Maastricht University, the Netherlands. He has been the Director of the Public Health Institute of North Rhine-Westphalia, Germany. For 10 years, he had consulted the European agencies for reconstruction, the Balkan countries. He is the past president of the Association of Schools of Public Health in European region and past president of the European Health Forum. As a policy level advisor, he also served the European Advisory Committee on Health Research of WHO Europe and on the expert panel on investing in health for the European Commission. And he is also the founding director for the Prasanna School of Public Health, the Manipal Academy of Higher Studies. I welcome Professor Dr. Helmut Brandt to give us a brief insights into health, One Health approach in combating AMR experiences from Europe. Sir, over to you, sir.
Sir, please unmute.
So please unmute.
Yeah. Okay. Okay, I'm visible.
Yes,
you can see. Oh, you can see.
Yes,
it.
sir.
Right. Okay, good. Perfect. Yeah, thank you very much for the invitation and making it possible to report a little bit about the experience we had here in Europe. Europe is half the size of India. And when I prepared this, I first wanted to talk about all the different approaches in the different European countries, but it showed up that this would just put a highlight on certain issues. So I think it would be better to give you an overview about how the strategy of the European Union is, where the member states got together to discuss on this. And there are some similarities and some differences to India. The newest plan is the second EU action plan on antimicrobial resistance in the area of One Health from 2017. And I guess you will all get the slides later. So some of them are in small print, so you don't have to try to read it. You can have a look at closer to this later. And the interesting thing is that the second plan builds on the evaluation of the first one. And that there is an evaluation is not always the case in this kind of policy making. So that was a major step ahead. And the three objectives that Europe wants to go look at is making the European Union a best practice region and boosting research, development, and innovation, and shaping the global agenda. So those three topics were indirectly already mentioned also for the Indian approach to this. This is the list of content. Number 2, making the EU best practice region. Here you see it's about to create awareness, to produce better evidence, to coordinate better, and to address the role in the environment in new ways. Boosting research is developing new therapeutics or alternatives for this. New preventive vaccines shall be developed, new diagnostic tools. And there at 3.5 is a very interesting point, develop new economic models and incentives, because I think that will be very crucial for the further development. And then Europe begins to realize that it has to take a role in the global world to really try to influence what's going on. If you want to roll out this, then you have first to give some guidance to how to use antimicrobials in human health. That was already done 2017. This is a very interesting document where they put together the evidence and made guidelines for this that every European member state can use. Bigger member states like France would say, okay, we already have our guidelines, but half of the European member states are small countries like Estonia, Latvia, Malta, Cyprus. So they will not be able to gather all the evidence, and why should they repeat what has been done? So this is very helpful for those small member states to adopt them then as national guidelines. And what you do for the human health, you have to do for the veterinary medicine too. So you have now the basis that the member states can act on this. And every year there is now a progress report on this. And here's an example for what has been the undertaking for making the EU a best practice regions. There are several slides always for this. And what is good is this kind of presentation regarding a timeline and the promised deliverables. So you can really have very quick overview what is done when and which parts are still open. By this is helpful for the member states too, because they know what to expect, what already has to be done, and where they should be active. And this is also done for boosting research, development, and innovation on AMR, where explicitly all the different programs for funding and cooperation are mentioned. So when you want to have an overview about what's going on in Europe, please have a look at this document. It will show you exactly up to date what's going on. The same is for shaping the global agenda, where there is a list of the institutions Europe works together with and is in a way representing the European member states too. Last year, there was then a suggestion from the European Commission to the Parliament about a new pharmaceutical strategy, because the old pharmaceutical strategy did not include AMRs so very well, and new things have to be done. So at the moment in Europe, there is a big discussion about how we strategically should deal with new pharmaceuticals. There is at the moment a hearing for people, institutions, NGOs, that will close end of the year. And I guess next year there will be final drafts about how the new pharmaceutical strategy will look like. This is important to India because India is the pharmacy of the world, and Europe is one of the biggest customers. Of course, you have to do some more and better monitoring of what's going on. And there in 2020, last year, there was a new decision how to deal with this in the area of AMR, in zoonotic and conventional bacteria. And what I underlined here in red, text with EEA relevance means European Economic Area. This is important not only for the direct member states of Europe, but all of the member states that deal with Europe, because they have to apply and stick to these rules in this this decision to export their goods to Europe. So we see that this has a kind of economic consequences too. We already discussed you need research to go further. And the EU Health for Health program that started this year and will go up to 27 has around 5.3 billion euros. And AMR and One Health is a cross-cutting issue. You will see here on these 2 pages of the major summary, not directly One Health mentioned, but when you look in the details, you find it quoted all the time. So you might tell 5.3 billion is a lot of money, but it's only 10% of the whole research money available for research in Europe, because 90% still is national money, and the European money is more used to have an additional benefit, the European added value, for those things that you cannot do alone in your country where you need cooperation. And of course, you have to integrate farming. The EU Farm to Fork strategy from last year was a major step ahead. 80% of all subsidies that are given by Europe have to do with agriculture for historical reasons. So the agricultural business is very, very important. And when you look on the right part of the content of this Farm to Fork strategy, you see again a lot of things that have been already discussed. But what is interesting is that they want to reduce the EU sales of antimicrobials for farmed animals and in aquaculture by 50% until 2030. So there are some clear targets given that should be reached. So it will be interesting to monitor how the steps for this will be taken. One of those issues that is a little bit underrated at the moment is that we need a strategy approach to pharmaceuticals in the environment. And that's quite new. And on the other hand, we see that a lot of things are possible, but not really rolled out. And that's the pie chart on the right. There you see that around 10 activities have started, ongoing are 15, but good progress are only in 5, and implementation achieved only in 3. So that is, for example, a topic where we are still lacking very much behind. And what is a very interesting idea is that some years ago, an AMR network of all member states was set up. This is, for example, the agenda from the meeting from March this year, where you can see that all the important things that I just presented are covered here and discussed with representatives of the member states. And here then the new decisions are made how to go on. You have to see Europe is not, the European Union is not ruling the different member states it has. It's more kind of self-help group where all the member states can get together and solve those things that they cannot solve alone. In health, the European Union has a weak mandate, so it cannot rule a lot in this. So it's more about cooperation and coordination. And for example, this is from July this year, where the subgroup of national action plans met. You have state action plans, here they are national action plans. And they get together to discuss how to do this, how to roll out national plans. And for the smaller member states, this instrument that I showed you in the beginning are very helpful. This, for example, is the new Dutch AMR policy. And you see human health is in the center, and all the areas around are what we discussed now. So you see, it's complex. It's not an easy task. And you have to really work with health in all policy approaches to get this done. And the Dutch are always quite direct. So the challenges are at the bottom. How can we keep these issues on the agenda? Other things like the pandemic overrule at the moment, and what will come after is AMR and One Health always a topic that people would be interested in? How to keep the colleagues in the different ministries committed that the AMR response is shared responsibility, that it's an issue that they should take care of because other things on their daily agenda might be more important. And last but not least, should AMR be a separate issue, a ministry for One Health, or part of the wider infectious disease response, so a cross-cutting issue? All these three topics we indirectly have already discussed. So you see, they're coming up in the European discussion too. So that was very short to catch up a little bit of time. And thank you for listening.
Thank you so much, Professor Dr. Helmut Brandt, on giving us a clear image of the European policies and experiences in One Health approach in combating AMR, and the various strategies that the European Union have been applying, like the farm to fork strategy, then strategy approach to pharmaceuticals and environmental, and the Dutch AMR policy. It was really insightful and a good glimpse of the experiences from the European context. Now, I would like to go to our last speaker of the day, Mr. Muni Mohan, who is the founder of a Rural Institute for People Enlightenment. And he is having a 30 years of experience in the rural and urban development, and have been working with various projects, activities during this period. He is also the individual monitor in the National Minorities Finance and Development Corporation, Ministry of Minorities, Government of India, from a period of 2005 to 2012. And I would like to welcome once again Mr. Muni Mohan to give us an strategies on regards to community level convergence among human, animal, and agriculture sectors towards One Health approach. Sir, please unmute, sir.
Good afternoon, all. Thank you very much for inviting me to speaker to discuss about various strategies and strengthening of the community level convergence among the human and livestock and the agriculture sector. So share my this one, sir. Slides I have given to you. Next. So, as I'm the chief function of NGO called Rural Institute for People's Enlightenment, this registered under Society Acts and Foreign Countries Acts, all legal status, working for a rural area and urban area development, different areas, health and education, community development, communities and things. Next, please. Next slide. So this is what we have worked with different funding agencies associated with government, international governments and state governments also. Different activities, different donors has supported for development activities in all sectors of the areas. Next. So the organization has been doing the works different what we have done so far. So sensitization of ABR and TB, HIV, co-infection and community health in Chittoor district of Andhra Pradesh. Next, services related to the drinking water and sanitation, horticulture, agriculture, natural resources, women empowerment, skill development, capacity building, monitoring and evaluations of the different projects which we have in the rural area and urban areas. Then capacity building to the community-based organizations at grassroots level. So capacity building means different skill upgradation and leadership development, as well as all different aspects of the groups. Next, currently our majorly we are doing the major today's task is we have given to that community level convergence among the human, animal, and agriculture sectors towards one health approach. No, we are working with the community now aspects. Academic previous speakers are spelled the in detail about that one, but according to the public, general public, we have to give awareness among those people regarding not only human but also animal and the agriculture sectors to reduce the antibiotics more. That one, that is the topic today. Next. So this is already given. The AMR challenge encouraged one health approach, managing the health of the health of animals, the environment, community engagement, which comprises empowering communities to take action to enhance health and eliminate health inequalities, has proven to be beneficial in improving the people's health-related behavior. This is important to we address the issues among the public. There is already proven strategies of the committed areas to combat the combating of ABR. So GDS are limited antibiotic use and follow the basic infection prevention strategies such as hand hygiene and sanitation. Our NGO is involved in creating an awareness on these areas to different target groups in order to address the aim of all human, animal, and agriculture at the environmental levels. Next. So this is what are the causes to antibiotic resistance. This one is slide from the this one. One is this are world like this one. Pre-prescribing the of antibiotics. This is different already. People are previous speakers are number of times they need not once again repeat again. So these are over prescribing of antibiotics, patients not finishing their treatment, overuse of antibiotics in the livestock and fish farming, the poor infection control in hospitals and clinics, lack of hygiene and poor sanitation, lack of new antibiotics being developed. These are causes for the ABR, combating the ABR. Next, please. Next slide. The hand wash program under this is the only pictures of this showing the community level also. Next. So majorly this is the our target group. How to enlighten them towards combating the ABR. So we have segregated the different groups. We are working with these groups for the last 25-30 years like that. Capacity building in all below groups, including animal handlers and the farmers, not only animals. So there we have segregated the different kind of groups: ASHA workers and ANMs, Anganwadi workers. There are the grassroots level workers, caretaker of health. So that what we thought that we have to give an awareness on combating the ABR or the antibiotic resistance. Then in turn they will go to the in turn they will give to the general public. They are working with the grassroots level. That is one as one. Number two, NGOs, non-government organizations are working. Number of NGOs are working in the rural development, urban development. They are working with the number of groups, number of issues like health, education, and agriculture sector, horticulture sector, and livestock sector also. So that we would like to give a training program or capacity building to the NGO workers. Then in turn they will go to their field areas. Then they will discuss it or give the trainings on and combating the ABR. That is the second target group. Third target group is Panchayati Raj institution members. They are the political people. They are people's representatives at the grassroots level, Panchayati level, so that they are very capable to enlighten the local public That is one aspect. That is the assumption to give the awareness or knowledge capacity building to the panchayat registration members. Number 4, farmers. Farmers are the producers. There is a need to give an awareness or knowledge about the antibiotic resistance to combating ABR. So they are the producers of the food grains. So they have to know what is what. So they are consuming more chemicals and antibiotics. That is, then they will at the same time have to enlighten the consumers also. Both are equal to producers and the consumers. That is one aspect. So women self-help groups. The women have a number of organized self-help groups in Andhra Pradesh or across the country. So they are regularly they are conducting meetings, trainings, and internal meetings like that. So when we do the awareness on the ABR for this one, then they will, in turn, they will discuss with their regular meetings about this subject. Then only it will aware the all the general public very easy method to spread into the women community also. That is one aspect. Sixth one is this is WASH program, village water and sanitation companies. They are purely for these water and sanitation companies already organized and set up in the villages. So that we would like to give an awareness to the water and village water and sanitation company members. Then in turn they will discuss about the hand wash or drainage or whatever, safe drinking water, so sanitation, hygiene, all these aspects. Now, when we are giving this kind of knowledge to the members, then in turn they will give to their public, their village people or community. So easily spread the information about combat of the APR. So this water users association, this is irrigation water users associations also. There are one registered societies. They will also the same concept and curriculum. We will provide them and give the trainings to them also, capacitate the groups. Next one, farmers producer organizations. This back. Farmers producer organizations. There are the different producer organizations are there. Commodity wise FPOs are there, general FPOs are there. No, so suppose you see mango producer organizations, they are using farmers, they are using more chemical fertilizers. That is very dangerous to human health. So that we have to give knowledge to them. Their registered societies are there. Then we will give the board of the training to the or capacitate the board of directors the producer organizations. Then at the same time, we have to give the awareness to the consumers also, who they are eating mangoes or whatever is food grades. There is a link, a convergence between all three aspects of producers and consumers also. That is a major aspect to enlighten the general public. Next, primary and secondary school teachers. The teachers are playing a vital role into the education institutions. Then they have to give one separate class to the students. That is the assumption to give training to the teachers. So in time they will give their parents committee also. They are discussing about with the parents committee till students. They will give an awareness to the students and parents committee. That is our assumptions to capacitate the teachers. This is a major object about the convergence between the agriculture and horticulture. Fish farmers means all farmers will come. Fish farming, dairy, poultry, agriculture, horticulture, all aspects. We have to use all the different aspects regarding antibiotic resistance. Next. The major object of the ABR program is to create awareness and motivate the community-based organization people on general health, hygiene, and sanitation. So this is object to the general public. Then what is antibiotic? Its utilization, impact of the ABR on human and animal health. So this is a ABR burn in the world in India. Also discussed in the same public, general public names. Next slide, please. So these are the we have organized one training farmers, mango farmers producer organizations. We are conducting regular meetings with the for pre-production, post-production of the mango crop and different agricultural crops. When we discussing on the trainings, this is also incorporate the one of the topic in the trainings. Then they will that is useful for them also. Nowadays, they all are promoting the organic produce to reduce the different kind of diseases. This is a major objective. This is the farmer produce organization training we are given. Next. This is also same. This kind of trainings regularly organizing the water user associations, farmer produce organizations. So in every training, we will include the one hour to the regarding the health aspect and the antibiotic resistance also. It is easy to motivate and mobilize the community people. Then they will go to their village and discuss about the combating the APR. Next slide, please. This is we have organized one first dissemination camp with ANMs and ASHA workers. So they are all organized one training program on this exclusively on this antibiotic resistance with convergence with the health department. So this is also very crucial. They are playing very crucial in the society. That's why we have capacity there. Health workers. Next. These are the speakers in the ASHA workers training. One of the all are MBBS doctors, some social workers, and all these things. Next. This is also same. The doctor. Next. This is also same. Thank you very much. This is the brief discussion about the strengthening of level convergence among human and animal husbandry, livestock, and fish farmers. So that thank you very much. If any queries or clarification you need, you can ask them. I will clarify it. Thank you very much, sir.
Thank you so much, Mr. Muni Mohan sir, for enlightening us on the various areas of convergence with respect to the community level aspects on combating AMR in human, animal, and agriculture sectors towards an One Health approach. So this comes to an end of our this workshop. However, we have got two questions to be answered. The one question, it goes to Prakash sir. How to strengthen multi-sectoral coordination on antimicrobial resistance? Prakash sir, are you there, sir?
Yeah.
Yes, sir.
Am I audible?
Yes, sir, you are audible, sir.
Yeah, so I think when Professor Helmut and Dr. Sunil was mentioning about the same issue, as it's sectoral, and then we have to prioritize the issues, and we need political will, we need funding, we need maybe one approach which Professor Helmut and Dr. Sunil was mentioning is do we need a separate cadre on health? That is another thing. But anyway, I think India government is taking it up, and there's a National Institute for One Health is already set up in Nagpur. Yes. So multiple ways they are doing. There's global action plan. They're talking about all the other aspects of 5 objectives, and our national action plan is talking about the partnerships organization. So even the states which is already mentioned, like Kerala, Madhya Pradesh, or Delhi, so they're all talking about partnerships, collaboration, coordination committees, and say pharmaceutical industries, or that is their main agenda. means other departments, other sectors, public-private partnerships. So that's already taken care by those states, which is already means taking it forward. And now some of the states, around 9 states, are the phases in the process of developing or maybe implementing the action plan. The first step is to identify the partners. So yes, it is not that easy, and it is very specific to each of the states, where some states means there may be better coordination for different issues, maybe global health security as part of global security agenda, or outbreaks, or maybe different issues. But in any case, we have to, or maybe so there should be proper political will, resources, dedicated staff with technical capacity building of the partners. There are many aspects we have to cover. It's not just one aspect, I think, and plus roles and responsibility, or you can say the guideline. So many things are required or essential to have a multi-sectoral collaboration. So the presentation I was giving all these points, but implementation, there are a lot of challenges. That's also I think all the speakers mentioned. So that's there, yes. So we need to act. I mean, all the sectors has to take the ownership of this particular issue. Then only it will be successful. That's that so I hope I try to answer.
Thank you so much, sir. I have 2 questions for Mr. Munimohan, sir. The first question is is there any study to find out the source of antimicrobials in groundwater and river water? And the second one is, have you got any tangible benefit achieved towards AMR goal after awareness campaign that you made from your NGO side?
Yes, no, always no, whenever you go to the site testing, water testing, they are doing that one. So that that result will come automatic, this one, that is one. Another thing is tangible results means definitely it will come when we give to the inputs to the community, automatically output also we expect from them. So some are behavioral changes are they are asking while doing the training, what kind of is the need of this, that is give result to the what they are learned from the training or the awareness camp. That is the result. The awareness is not measurable, so that feedback and behavioral changes only, that is the output from the community.
Thank you so much, sir. Now I'd like to invite Associate Professor Himanshu Shekhar Pradhan, sir, Project Coordinator, Preventive Project, to conclude the session and conclude the workshop.
Thank you, Jyoti. So it is honestly, this workshop is extremely insightful, and because and the range of deliberations and the intensity and this quality of the content was extremely, I mean, very much encouraging to the participant, and I'm very thankful on behalf of the School of Public Health and Preventive Consortium. I sincerely extend thanks and gratitude to all the esteemed speakers for today's their deliberations and their contributions in direction of antimicrobial resistance, for their time and their contributions. And the deliverable, each of the deliberations are extremely insightful. And I sincerely thanks Professor Sudhir Kumar Sapati. He has given a very insightful aspect of One Health approach, and also I'm setting this further discussions. Dr. Dona, actually, she has reflected on this burden from a perspective of global, regional, and national perspectives, and it was extremely nice. And then we are so thankful to Prakash sir for his reflection on different strategies, models, how this intersectoral collaboration can establish in the direction of addressing AMR through One Health approach. So thankful, I mean, from this school and consortium, we're so thankful to Professor Sunil sir for his extremely, extremely very nice way he depicted how Government of India has taken different initiatives in the direction of antimicrobial resistance with special reference to One Health approach. And also he nicely reflected the gap and the way forward. And we are so thankful, Professor Helmut Brandt, sir, because he has reflected this European approach and a different model, how European region, they are trying to address this AMR through One Health approach. And we are also so thankful to Mr. Mani Mohan. He has reflected the community level convergence, and from his experience, what are the different initiatives and activities he has through his collaborative government, non-governmental organizations, they are trying to undertake at field level. So all this deliberation is extremely enriching. So we are so thankful, sir, to all the esteemed speaker, and we are also extremely, happy and extend our sincere thanks to all the consortium partner of Preventit and all the team member of Preventit consortium for their, facilitation directly, or background work, because because any success of any event, there are many people working behind the scenes. So I'm extremely happy and extend our sincere thanks to all members of Preventit consortium to make this workshop to happen. And at the same time, I also extremely thankful and to extend our sincere thanks to all the participants, those patientful for their patientful hearing and participate in this nice workshop. So thank you so much, and we look forward this kind of collaborative activity in your future, and we look forward your participation in this as well. So thank you so much. So now we are formally winding up the sessions. Thank you so much.
Thank you very much. We are leaving.
Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, everyone.
Thank you. Thank you.
Thank you. See you.